5:30, and I'll call us meeting to order. Next we have a quorum.
Yes, Madam Chair.
We're gonna have a talk.
Yes, we have a quorum. I'll speak up.
I do not know if I can handle my phone. Okay. If you want to say the pledge, and then
Sure.
just immediately following that, I will pray for us.
Yeah, of course. Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Father, we thank you for this hospital, and we thank you for the people who work here, and we thank you for the people who are able to help. I just pray, God, that you give us wisdom and help us make good choices tonight. So in your name we pray. Amen. Okay, do we have any additions or changes to the agenda? I wish to do the whole thing.
So yes, I have two motions I'd like to add to the agenda. Fairly different as to where. I guess we could just address them right after old business.
So, do they have to do with personnel?
The first one does not. Potentially does.
Okay, so if it has to do with personnel, we'll do an executive. What's the first one?
First one is just a vote to authorize a report be provided to the board at our next board meeting to detail what contracts that WCH has in effect with H&H and when these contracts expire. And also the report will include any plans for new work or spending for these contracts.
So they fit better under old business?
You, wouldn't it?
No, do they fit better under old business or new business? That's when we look at business. Oh, okay. Is there any other changes to the agenda? Kathy mentioned one we don't have the introduction of Shane. So we'll add that right under 8. Yeah. Okay, so any other changes to the agenda? So I would entertain a motion to accept the agenda with these things added.
I move to accept the agenda with the additions.
Madam Chair, I will second that.
Okay, all those, let's see, so all those in agreement with the agenda, say aye.
Aye.
All those opposed, same. Okay, so now minutes. Do I have we move the consent agenda with approving the minutes?
So I did look at the minutes,
Okay.
and I have a vague recollection that at Kathy's request, can everybody hear me? Okay, I'll just keep it. I have a vague recollection that Kathy requested we expand our services. I'm not seeing that in the minutes. Does anybody remember which meeting that was at?
That was the last one, yeah.
Yeah, does anybody see that in the minutes?
So what meeting is that?
So
July 31st.
Okay.
See?
Is it a motion?
It was a
yeah,
motion.
I think the
And I-
board officially voted and it was on the agenda to expand services. I'm not
Oh,
seeing-
I didn't catch it. No, I read it.
I was in the bottom of the hill. We watched Chris give his post. Here, is that, hey, beat your time. You got, of course, good luck. Okay. All right, Chris. You ready? Let's absolutely. Chris. This is a skill buzzer. The 10 truly gospels that will test the will of even the most experienced guy.
No, I just was wondering if she had muted it. She got
Yeah,
it.
she's got a meeting.
Okay.
So that last meeting minutes, I missed some stuff on it, so can we just not include that one?
The July 31st.
Right, are we sure that happened at July? Because we had a July 25th, and I can't remember which.
It was at the 30th first, and I will look at the recording and make sure I get it right.
I wasn't at that time. I don't know.
And didn't we also at the 31st vote to approve Kathy's request that Karen Paul would step aside for cost savings? And then we also in conjunction voted that Tony would expand his services.
Yes.
Okay.
Yes.
So I think that is missing 4 minutes. I think that should be noted before we approve it.
Well, I don't, if you would not prove that, because I don't know who made the last motion and when it ended either.
Okay, so can we move to, do you feel safe moving to approve July 11th and 25th, but not the 31st currently? Yes, okay. So do we have to have a motion to amend the consent agenda then?
I don't think we have to amend. I think that the motion maker could change their motion. The second could second that.
Which I don't think we can change.
No, you
the
have
motion
not.
yet.
Okay. I thought we-
No, I know, I had moved to accept the regular agenda. Yeah, you
Okay.
moved to the agenda, but
Right.
not.
Alright.
We haven't
Yeah.
voted or made a motion on the consent agenda yet.
Therefore, Madam Chairman, I move that in the consent agenda, we accept July 11th meeting minutes approval and the July 25th special meeting minutes approval.
I second the motion.
All those in favor say aye.
Aye.
All those opposed, the same. Okay, now, do we have any visitor comments? Yeah. Okay, just 1 second. So let's try to limit our comments to about 2 minutes and say your name first.
It's funny, and it may go over 2 minutes. Because I am very, very upset. I have the information from the lawyers, their information. I have read some investigators' report. And from what I see, this board, certain people on this board have done a very disservice. Okay, so addressing Ann and Allison and Carrie, you have taken this and we have done this for 4 months. We have, I'm gonna drag this out. People have come to meetings for 4 months, and they have expressed their interest in having Piper back on. And so, you are you have done a disservice because you have taken. You need to do what is right and decent. You need to do what's best for the hospital and what's best for this county. You have taken her, and what you have done to her is absolutely criminal. You have taken things and made them charges, and you have never let her defend herself. You have done all of this just to destroy her life, her career, and everything else. And so you need to do something about that. I consider you very, very evil people in what you have done, because you have no conscience as to what you are doing. And so for my fellow people, I read the report, the investigation report, and it said that Piper was doing her job. His recommendations stated that it was her job, but I suppose to maybe console the board a little bit that he didn't find anything, that maybe she needed some more training, and maybe someone could follow her a little bit more closely. So then, in the investigation, this is the third meeting you've had that investigation. And in Piper's letter from your lawyer to her last meeting, after having that investigation said she was exonerated, and you voted to have her resign because of these 4 things that she was already exonerated from. And so then it went back to Piper's lawyer. Allison said, well, these 4 things, and he pointed out that they were in the investigation, that they were exonerated, and you still. So she took it, and so he said, well, he would take it to his HIPAA experts, and they did. And these experts in his large firm said that these weren't even anything heinous, and they would not even have been investigated by their people because they weren't anything. And then on top of that, they were part of her job. And you keep dinging on them and saying that and so all I can say is you 3 are doing this out of a personal reason. I don't know. Why are you trying to destroy her career by not even following your investigation report? You are evil. You're very, very evil by doing this. And this people, this is not the first time the old board has done this. They railroaded Maureen out of her position with the same tactics. They found one little incident, they harped on it, never let her defend herself, and then lied to us, the public, that she had retired. That is not true. So you need to think about what you are doing. You need to resign from the board. You guys should be gone because you are doing criminal acts, all 3 of you.
Are there any other comments?
Hi, I'm Angie Phillips. I emailed you guys all today. Again, just like Betty says, you guys are affecting someone's personal life and their career. And she's being affected by this immensely. She was doing the right thing. She was doing her job. You guys have the report. It was unsubstantiated. You need to stick with the facts. I don't know what risk that she is to the facility. She has done nothing but benefit this facility for years, decades. So I really need you guys to stick to the facts and let her defend herself. Have you guys ever once sat down with her and asked her? The answer is no. You have to let her defend herself. Talk to the people that work with her. Like I said in my letter, not one of the admin team was talked to. The original administration team, not one of them was talked to. And guarantee you, if you would have gave me a call, I would have said, yes, that was in her job description. That is what she did, and this is why. And also, look at your job descriptions. All of them say as duties or other duties as assigned. Why? Because we're a small facility and we can't afford to hire different positions to fill these roles. So a lot of us wear many different hats our entire careers here. So please stick to the facts, and please, let's do justice for Piper. She doesn't deserve this.
Any other comments? Thank you. With the whole thing, it's Tabby, are you ready to introduce our chief financial officer?
Yes, I'd like to introduce John Gantner as our interim chief financial officer. Ron, thank you.
Pleasure to be here.
We'll be hearing from him a little bit later. Okay. And then I'd also like to introduce Shane Philippi. I haven't ever said his name right. Philippi. I'm not going to get it right tonight. And he is our nursing home administrator.
Happy to be here.
Thank you. And then we have Tony Blake. Tony Blake is our interim CHRO.
Yeah. Are you doing your CEO report?
Sure. My CEO report. Mainly what I've done this week is work on getting, this last couple of weeks, I'm working on getting some interim help. We had one interim that did not work out at the clinic, so we had her replaced or having her replaced. So I talked with 4 different physician or nurse practitioners, and I have Dr. Franklin talking to one of them for me, just to kind of validate some of the pieces relative to primary care. She has a lot of urgent care experience, but I kind of want to make sure she has plenty of primary care components. Is this for all clinic providers? For clinic providers. And what else? I've had a relatively big time on investigating a trauma case, just with the situation that went on with that. We have been very busy in the finance area, making sure that we turned in paperwork that we needed to Meridian, so that we can get our IGTs or the funds that we get back from the Medicaid, the programs that we do with the intergovernmental transfers, whatever, back for our nursing home and for our acute care. And I just got one for the providers now too. So we're getting those pieces completed. We've been working really hard on trying to come up with some, I don't want to take John's thunder, but we've been working real hard to come up with some numbers that we can work with, so that we actually are starting to be able to build a story basically of how we're doing financially and what's going on with that. I've done, I think, personnel, just meeting with a lot of people one-on-one, spending time with them, talked to a couple of one company so far, and we have 2 tomorrow that are IT compliance type companies, so that we can look at our compliance plan and look at our IT security network. So those will be something that we bring forward to the board later. Yes, Wendy's a part of it. Absolutely. Yes, that's the short version.
What's the, what's at the clinic right now? What do you have for locums right now? How many?
Right now we have Laura, and she's a PA, is that right? No, she's a nurse practitioner. Laura, she's a nurse practitioner, and Dr. Sherry Blanchard, which we are working on bringing over permanently. And then Dr. John Haber, well, he's not local. So he's not local. So we've got two. Yeah, we've got two.
Dr. Haverly, full staff, full time now. Thank you.
Well, he's 30 hours a week.
Okay.
And then we have still, just so you know, Jan, I think, is planning on retiring. We've been trying to play phone tag. She goes a lot of places, and we're trying to define when her last day will be before she retires.
And Dr. Reimer still at his school.
Yeah, he hasn't mentioned anything relative to that, really.
Until the end of the year, then I'm gonna retire.
Okay, end of the year. So he mentioned that, but I wasn't sure, so.
No, I think I told you all 9 months ago.
Thank you.
Okay, so now we're up to finance. Yay.
Thanks. So it's an August 15th meeting, so typically, I would expect to be bringing to a meeting like this to July financial statements, balance sheet, income statement, cash flows, supporting statistics, and budget actual comparisons. But as I think you all know, we're not there yet. That's our goal, but we're really not there yet. So what I'd like to do is talk about where we are, as I see it. And I've been here 4 days, but had done some work before I arrived here. So I did put a couple of exhibits together, and I won't spend a lot of time on them, but just to try to graphically explain where we find ourselves. So the way I look at the finance functionality in any hospital, it's really at 3 levels. There's, at the bottom of this chart, there's a foundational level. So if this were a football team, we'd be talking about basic blocking and tackling. So in that foundational level, that's where we master accounting, reporting. We're tracking our transactions daily in various subsidiary ledgers. We're concerned about internal controls and the internal control environment. We're focused on safeguarding the assets of the organization. And of course, we have to keep up with regulatory reporting and compliance while we're doing all that. So that's a basic building block of the finance department.
In addition to the weekly printed version of the newsletter journal, we also promote our community and share important information on our award-winning website, newslj.com, and in our weekly email newsletter, Nuke Now. We also connect with readers through various social media platforms and invite you to check us out on Facebook, Twitter, and Instagram. You can even take a look at a recent meeting of the City Council, School Board, or County Commission on our YouTube channel. We do hope that you will go to newslj.com and subscribe today, and we look forward to making all of our great content available to you. But regardless of your level of support, we thank you from the bottom of our hearts for doing your part to preserve a free and independent local press.
We're focused on safeguarding the assets of the organization. And of course, we have to keep up with regulatory reporting and compliance while we're doing all that. So that's a basic building block of the finance department. With those tools in place, you can move up to the second level, where we assist the operators in the organization with conducting their business. So that's where we get into having a budget, developing the budget in a participative fashion, and then reviewing budget versus actual results and analyzing those variances, taking corrective action if it's indicated. And we're also helping the operators with capital investment decisions. So that's that second level. And then ideally, we want to have mastered those first 2 levels, and that's when we can do the fun stuff. So that's where finance can chime in on strategic decision-making. So I think there's lots of opportunity here to add services, to evaluate the healthcare needs of the community, and to with a lot of discretion and carefulness, maybe add some physician coverages, specialty coverages, so that we can make our facility more attractive to the community and providing a better service. So we're not really quite there yet, although that last step is very, very important, because a strong organization has to have sustained revenue growth. And we'll talk about our revenues, but they've essentially been flat for the last several years. So we're maintaining best case, but we're not growing. And if you look long-term, what does it take to be a solid long-term player? You need sustained revenue growth. So we'll work on that. As the arrow shows, we're really very much down at that lower level now, although we're trying to provide as much assistance as we can to the operators as we do that. But that's kind of where we are. I wanted to bring some numbers in today because I'm not used to having a finance committee meeting without some numbers. And there are a couple of topics that we talked about when I was interviewing several weeks ago. So I just wanted to explain where we were with those. So is the first sheet you have, is it the volume numbers? Go, any order.
Any order.
So let's go to the volume. So this is a basic in running a hospital and running a finance department, evaluating finances. The statistics that we need, they exist, but at the moment, they're not all funneling up to a single place, and they're not available to the leadership, to the board, to make decision-making, to track how we're doing. So I tried to pull a couple of key statistics together. The longer range plan would be to identify where these numbers are coming from and have them flow up to a single source, and they would be put into a format and brought not only to the operators, but also to the board, so you can track performance. The good news is the information's there. The bad news is it's not all coming together automatically, and so I had to dig through it a little bit. Maybe I'll find it, but I don't think it's coming together right now. So here's a couple of statistics. So top of the page, rural health clinics. And the way this is laid out, I took July of 2024, compared it to July of 2023, and you can see that the volumes are down. Now we know why. We're short of providers, and right before I stood up, there was some discussion of some of the new advanced practice nurses and physicians that'll be in those clinics. And I spoke with the person who runs the clinic yesterday, and they're already seeing a pickup in the volumes in August. So I think that decline in July at the clinics, I think it's temporary. I think the actions have been taken to restore it, but we can expect some softness in cash flow and revenue because of that decrease in volume. And if you look down, I won't go through every one, the ER relatively strong. And if you go back to our average number of ER visits per month in 2024 and 2023, we're actually on a slight uptick in ER, so that's good. But that's probably about the only service that when you look over multiple years seems to be slightly upticking. Everything else is pretty much flat. So once we get some of the detail work behind us, we want to focus on growth in revenues and volumes. And that also means we're providing more service to our community, which is what it's all about. So this is a very basic presentation. It's not what you should expect from us. We will improve on this monthly as we go forward and get it to where it needs to be. But we have to start somewhere. So an attempt to show some volume numbers. The next one is some actual accounting numbers, finance numbers. One of my concerns coming in here was, where do we stand with cash? Because cash can run very, very lean in critical access facilities. And so I wanted to be sure we had enough cash on hand to get the work done that we need to do. And so literally, how much runway do we have to work with as we're trying to affect change? So I went back 6 months, and I went into the journals, and for each month, I took the total cash receipts. In the second column, the total cash disbursements. And then I just took the difference on a monthly basis. How do our receipts each month compare to our disbursements? Are we building cash or are we burning cash? So you can see it varies month to month. Some months have 3 payrolls in them. There's 2 months of the year that have 3 payrolls. Sometimes cash is higher because we get a settlement from Medicare, as an example. By and large, if you look through those 6 months, and it's the number in the upper right-hand corner, our cumulative change in cash over the first 6 months of this calendar year is $960,000 to the plus. So we've actually built cash over the first 6 months. When I take that 960 though, and I look more carefully at it, 601,000 of it was a Medicare settlement, a one-time settlement of a cost report, and 322,000 was a grant that is restricted. So if you take them out, we kind of broke even, which isn't necessarily bad, but we certainly want to be building cash. But there's one more factor in all this. We were holding checks. So accounts payable was processing checks, but not mailing them out because there was a concern as to where the cash balances stood. So we started catching up those deferred payments in July. If you look at the disbursements in July, they're 2.1 million. It's a little higher than typical. There were probably 400,000 upheld checks that were dispersed in July. As of the date I did this, which was July 13th, there was another 464,000 upheld checks in a draw at accounts payable. So when you're looking at cash, you've got to treat that as though it's not cash, right? Because it should have been out the door or will be out the door soon. So I would say cash is tight and probably slightly down when you take all these factors into account. You know, we that can't go on very, very long. The bottom half of the page, I did a day's cash on hand. Now it's a rough calculation based on the information I had. But if I look, when I called the banks, the operating cash was 4.5 million. We have a CD of 2.1 million. So this is an actual bank balance, $6.6 million cash in the bank on August 13th. But we had a check run the Friday before, and those checks, most of them hadn't cleared, and they will. So we have to deduct outstanding checks. We're not caught up on our bank recs, but we're getting there. If we were, we could use general ledger cash balance, but we can't. We also have another 464,000 upheld checks, and we have that restricted grant in those monies. So I take those 3 things out to get an effective adjusted cash balance, and it's about $5.4 million. Our estimated daily cash is around $75,000. So when I divide the estimated cash balance of 5.3 million by 75,000, it looks like we have around 70 days, 71 days cash on hand. And that was as of the point that we did this. We had 3 payrolls this month, so it'll be a little bit lower if we did this analysis 3 weeks from now, as an example. So we have some money, we have some cash, we have to watch it carefully. We have to try to identify the reasons why it's shrinking. I think some of it is we got a little soft on volume in July. We're going to feel that, and frankly, some of the expenditure lines look a little higher. Payroll seems to be edging up, so we'll need to look into those things in more detail. But that's where cash stood a couple of days ago, and it's about the same today. And the last paper in here, and I won't, it's just a lot of information. But before I arrived on site, just in my mind, I go through and I say, it's not exactly a work plan, but it's kind of a work outline. So what are areas that I think have payoff for us or are important for us to focus on as I come in here and start to do my work? So on the revenue side, we file Medicare cost reports. There's an opportunity to legitimately optimize how much money we get through the Medicare cost reports. So I think, we'll certainly focus on that. 340B came up on my interview call. I think we're going to hear more about that this evening. Revenue cycle generally, I think is always an opportunity in healthcare in my experience. We got to look at charge masters. I don't think we did the last update, we might have missed them 4 years ago that we had it reviewed. And we've done kind of a general update each year. It may be time to do a more detailed deep dive on our charges, make sure that they jive with our managed care contracts. So again, I won't go through everything, but these are just areas that I want to focus on: accounting and reporting, the finance staff, make sure we get the right people in there to get the job done. And hopefully for next year, we put together what I would call a more traditional budget, where we work with the department heads. We have statistics on our side, and we put together a budget that drives the organization a little bit and encourages people to perform efficiently, but to grow a little bit. We are probably a month away from getting the audited 2023 financial statements, so that's pretty good. 2024 is a different story. 2024, the first 2 months of the year, I think, were under the Meditech system. The remaining months were under the SAGE system. And that implementation really didn't work very well at all. So we're getting assistance right now by outside accountants, and it's expensive, but they're doing bank recs, they're doing journal entries. We've identified a number of transactions, small ones, but they're being managed at a department level outside of the general ledger. So we got to suck all of that activity into our general ledger so we can be good stewards of the assets of the organization. So we are down in the weeds, really in the weeds in 2024, and it's going to take quite a bit of time, I think, to get a clean financial statement. So once we get 2023, we'll now have opening balances for 2024, and then we just have to get all the subsidiary work included in 2024. We'll get there, but it's going to take months. That part's going to take months.
Yeah, and I forgot to mention that we really are looking for one of the accountants to come on site so that we have some help directly on site in order to really get this done the way we need to be able to get it done. So
That's only the accountants from Durban.
yeah.
Yeah. And I think we have a call tomorrow at 8:30 or 9.
Right, we do. We have a
With
call
Durban to
8:30.
understand their plan.
You know, without somebody coming in and helping, we're just, I've been here 6 weeks, and so I can tell you that we've just really struggled to get all of the data done. Somebody needs to spend a full-time job doing that. We've all got other jobs too.
Literally recreating probably 75% of the activity that needs to be journalized. It's out there, but it's not in there.
So, John, can I ask you a question?
Sure.
So on the cash disbursements, I know August we did have 3, we were scheduled to have 3 payrolls.
That's right.
But I don't think we had one in July or June. And so, you know, the maximum spread between cash disbursement ranges from 2.3 million to 1.6 million.
Yep.
And so, as a suggestion, is everybody on the cash flow snapshot? So as a suggestion, under the cash disbursement heading, could we see payroll and then
Yeah, we could
everything
have.
else?
I put them together.
Right.
But I actually collected it that way.
I think it's a surprising level of variability.
Yeah, well,
And I would be interested to
well,
figure out, is this a payroll variability or is this other things that are moving up and down
so
substantially?
we'll make sure we provide. That's very easy to provide. I can tell you in the month of March, I think there were some capital expenditures. If you look at 2.3, there was some capital. If I had broken out payroll and non-payroll, you would have seen payroll relatively stable. And you would have seen the others. I don't think I would have had an asterisk on it.
Might help us answer questions.
Yep, it will help you, especially. That's why I didn't include it.
We don't want more questions today.
So that's, I'd be happy to answer any questions. Just want to leave you with, there's a lot of work to be done, but it's all doable. I think in the finance area, the morale is good. I think people are anxious to get it to the point where it's more of a well-oiled machine and less hectic. So Kathy and I this week, I started on Monday, and we had 3 or 4 requirements to submit information to get our IGT payments that were due. One was, I started on Monday, one was due on Tuesday, one was due on Wednesday, and I think one was due today. We got them all in, and then some, but it was kind of crazy.
So John and Kathy, can I ask a quick question on behalf of the staff? So I continue to hear, and I'm not blaming or anything
Well,
like
that's
that,
okay.
but I just want to make sure that it's being clearly understood that there continue to be some hiccups with payroll. And
Oh, yeah.
I just want to make
Yes.
sure that everybody knows that we know. and
Yeah.
We're doing everything we can.
I should have brought that up. I'm sorry, I was very busy before I got down here, but, there's some stuff with the PPL, the paid time off. And what we found is that we're finding there's about 3 areas of focus, which some of the data that was pulled across for the hours was not spread correctly or done correctly. The second part of it is that people took vacation time throughout this summer, some of the people did. And when they did that, they still continued, not only we accrue when they're on vacation, but what they did is they were still building accruals and not having any of their PPL pulled out. So one of the things that I had decided, and hopefully you'll understand why, is that we were going to try to get that corrected, and we would take people to a 0 balance if they've used it. And if they went to the negative, we're not going to take money back from them on the negative. Even though it's not to the advantage of the organization, it's a mistake that we made, and we have to get corrected. We have a target of having that all cleaned up by the 29th. So that's one of the, and then nationwide is getting very close. I think that will be cleaned up. That's an interesting one too, because basically they pulled across our year-to-date numbers for stuff and did calculations on the part that we put in for cash to the employees. The employees are all right as far as their percentage, but the cash that they pulled in was more than we were obligated to pay. So they have a bunch of money they really actually pull us back. So we're trying to get that all square so that will be paid back.
So I saw an email today that Kelly is scheduled to come to the facility on the 22nd.
Correct.
If people have questions about these sorts of things, is she the appropriate venue for those questions, or
Yes,
should
she
they?
is. Yes,
Feel
they can
comfortable?
talk to her. Yeah, they can talk to her. I mean, they've been working with us, and Kelly's been working with us to try to get it fixed, so. It's spreadsheet nightmare is what it is, but we're getting it cleaned up, so.
Yeah, it's, Kathy and I were talking, it's, when you convert payroll systems, because of the sensitivity of payroll, usually you're running a shadow payroll or you're running it parallel. And so I think, some of this goes back to, whether it's ADP or Sage, but the way they managed the implementation of the new system, it doesn't feel like it was really checked thoroughly. These things should jump right out at this. So
Yeah.
we're also looking at what their obligations were under the contract, because I think it was not a clean implementation of the new system.
Well, and I do have a follow-up question. So we were told by the prior administrator that a company named Weston was somehow
And a training.
created to take part in the implementation.
That is true.
Yeah.
Yeah, there's a weekly contract that they were supposed to offer some of the training for Sage and some other things too that had to do with the finance department, but,
I just want to make
You
sure
want to
that
look
got
at that, yeah, I
passed
don't know
along.
if they came in or not, but
Yeah.
you should look at it.
I've only heard them mentioned twice, but I don't know how we got involved with them or what their involvement was. They remain.
They're an interesting, I've been
mystery.
trying to get a hold of them actually, and I finally got somebody that sent a potential appointment with me on the calendar, but I called them probably for the whole 6 weeks I've been here to try to find out what their role was with us and what we were looking at, and haven't gotten a response from them, which was disappointing.
And our, just so you know, John, prior administrator told me that they are somehow involved with doing our cost report work. I don't know if that's true or not, but.
It is, I think that they gave a proposal, and there's a proposal sitting in my office, which I was checking on as well. But we've since realized that one of the accounting firms, which is Durbin, is going to be doing the cost report.
The 22 and 23 cost reports for that first firm,
I feel
them or it wasn't
it was,
with,
No.
And then the 24, you haven't.
Oh, Casey
yes.
Peterson,
Casey
yes,
Peterson.
yes, he did the 23 cost report. Durbin's 23.
Les Whitley was prior to 22. Yeah, I don't see.
We've been archaeologists and in our work trying to put stuff together.
So the one thing that I did, the only time I've heard what we talked about was they were in the building at one point here a month or two ago, or 3 or 4 months.
It's got to be
Or you
before I
guys,
was
it
here
was
now.
before us, but it was just straight, no, it was with the new board, but it was before you. So, and, I think Randy just told me that Whitley was there today or something.
Yeah. Thank you. Thanks, Tom.
Thank you so much.
Good addition to the team.
Yes, thank you very much.
Yes, we're grateful you're here.
That's very nice.
to be here.
The new store. This is the one-stop shop. We have a pharmacy. We have a bootlegger's liquor. The deli, the food that you can get at a lunchtime is so amazing. The coffee shop. Certain Friday mornings, there's 30 people sitting here in all these chairs. This is the hub for people to come and visit, have their coffee, have their donuts. It's amazing what this area has done. Totally amazing.
Hey,
Madam Chair, I forgot to ask earlier, but if there's any chance at all that either after quality or before quality, Joy could do her presentation on 340B, just because of the timing for her and her family.
so will you do that, please, Joy? Are you ready?
Yeah. Thank you. So, should all have a 340B report, you know, our packets. I apologize, I'm starting to lose my voice today.
You want to one of the microphones?
Yeah, you want to make Joy.
Okay, we'll try to project then, because you're quiet.
Yeah, and then I lose my voice. Can you hear me now?
Yeah, that's better.
Sorry about that. So we put together a report on the 340B. There's been lots of questions over the past year. So I worked with Cardinal. We pulled the data on our actual purchases, and we worked with Century and Centrex, which is our 340B program, to pull some of those numbers together and see where closing out 24 we're at on the numbers for 340B. So when we look back on the scripts and the contract pharmacies, which would have been Weston County Pharmacy and the Manor Pharmacy that we were processing, we have scripts that went through that don't qualify, that we need to go back with manufacturers and attempt to make that whole. So when we look at the data going back, the data ran between 21 and 23. Only 74 of the scripts qualified that were processed, and the amount of savings on those scripts was pretty small at the top. When we look at the data and run through the ineligible scripts, we're looking, most of those scripts went through the Weston County Pharmacy, and we're looking at $34,000, $286.96 of underpayment to the manufacturers that we have to attempt to make correct. With the Manor Pharmacy, we ran $5,570.35 that we need to attempt to make correct. So we've got that coming up that we're going to go ahead and process and work with the manufacturers to see if how they want us to go proceed with that underpayment. Right now, those programs are paused. We're still accumulating, but the big factor is where our clinic lands on the cost report. So more to come on that as we look at cost reports, where they qualify, what qualifies, what we can possibly move around to get better revenue on those contract portions. So that's the bad news. Moving on to the better news, we process 340B through the inpatient pharmacy for acute care and outpatient infusions. We got that up and running in 23, and we pulled data from September of 23 through June of 24. So you can see the amount of purchases. Those are the actual prices we paid on the 340B side compared to GPO price.
And then our cost savings for running those medications through the qualifying portions was $339.24. So that is predominantly our outpatient infusions, as you're looking at areas where we can get some cost savings. And the revenue portion of that, we're working with some Epic for some reporting, would be tied to acute care and outpatient infusions.
Any questions? Yeah, do you have any questions? Thanks very much, Joy, for your job.
Okay, are we ready for the quality report then?
Okay, so you've got your MedStaff credentialing. So you've got Laura Koenig. Did I say that right, Koenig? She's a nurse practitioner over at the clinic. She's a locum. Wanting to come on full-time after her assignment, and we also got her early. So I'll have you guys review those charts. Go around them. Go around them. Two of them for you tonight. MedStaff. So our last meeting, we talked about some pharmacy stuff. We talked about gastrogafin, which can be used for CT, but there's a therapeutic dose that you can use to help with small bowel obstructions. So there's more to come. There was more research into that we need to do this including. And then Joy let us know that TNK and Alteplase are on the national back order, and that's a stroke medication. So big one. But we've got plenty on hand right now, so Keisha let us know in radiology that the physicist is going to be here on the 18th, so the CT is going to be down. So they are aware, that EMS is aware that we are going to be on divert while they're doing that. She's going to have them do the CT first, so that they can get that up and going sooner. And I believe the extra time is just about done.
Is done, yeah. They were doing testing in it, and I think they got it all cleared, so.
Lab, they're having a shortage on blood culture vials, all the things. So Monument Health has created a little flow sheet within Epic that will help the doctors have a decision making on if they need to do blood cultures or not. So Jim shared that information, and they will get some weird things to have on their back order. So yeah. So the nursing home report at the time, there was 36 residents. The leader did experience 3 deaths last month. So, and then 1 did discharge back home. Melissa called through the watch list to see if anybody's ready to come in yet.
That's actually an update that hasn't been changed. You guys have a couple coming in.
39, yeah, 3.
Home health department's going in for Heather. Acute care at the time, there were 6 inpatients, 2 skilled swing beds, and 4 intermediate swing beds. 2 of the intermediate swing beds were manner waiting, and then the other 2 were respite care. We went over our trauma survey. We made some changes to how we do our trauma panels, adding a lactic acid, and then just some other treatment options. Yes. And what? Yes.
Yes.
Yes. Yes. Yes. And that checks your pancreas for any injuries. Let's see here. That's about it for med staff. Moving on to quality. We met this morning. So we went over some quality initiatives that we're working on the acute care side, such as like our bed side, med scanning, making sure that we're being compliant with that. We went over our survey satisfaction results. Really good with all of them. ED wait times, they're looking really good, so I'm excited we would maybe try to challenge those numbers. Our benchmark right now is 150 minutes. We are talking about maybe bumping it down to 125 minutes. So I'll be talking with that at the next med staff to see how they feel about that. Right now we have 4 skilled swing beds, 2 intermediate swing beds. We weren't able to admit one because of their insurance. The Manor, Shane is here. He's been doing great things over at the Manor. We went over our annual survey results. We got things on hand hygiene and nursing home administrator. Shane is here. And then the 5-star quality rating, he kind of took a look at it. Right now we're at a 2-star, and he's thinking maybe there's some adjustments we can make.
Yeah, there's some low hanging. That's pretty quickly. Get it up in the next 3 to 6 months when it comes out every quarter. So.
And then, like we said, we've got 3 coming in the next couple weeks. Census is 39. Kathy kind of touched on the payroll issues that are going on. And then we talked about the AR days. I think they're down to 58. Yeah, he's making me do this.
Yes, I am.
But I just wanted to let you guys know on Monday I took a CPHQ test, and so now, and I passed it, so I'm now a certified professional healthcare quality. There's only a big deal. 15,000 of us around the globe in 2023, and the passing rate for the test about an average of 65%, even after taking the time. So I've been studying the last 8 months to take this test, and things will be coming.
No, that didn't hurt, did it?
No.
So I just wanted to bring up that I want to be able to bring an agreement with you and offer this issue to Dr. Sherry Blanchard officially. She wants me to get that done even before her contract is done. So I'm going to try to have that out if that's okay. Then engagement of her also as the medical director for the nursing home with the departure of Dr. White. So that would be something that I'm actually wanting to do because Sarah Bybee's last date is tomorrow. Yeah. So I've talked to Allison about it. She's already sent me the copy of the agreement, and it's standard. It's a standard agreement we have for all of them, which is $1,000 stipend. Yeah. $50 or something for each physical.
So do we?
I want that motion to be able to work on an agreement to hire. Sherry Blanchard.
Someone want to entertain a motion? Somebody wants to make one? I know. You just want a motion to.
I want the move to be able to get a contract to be able to employ Dr. Blanchard.
Okay, so I move.
Are we authorizing you to draft the contract?
Yes, to draft a contract and to offer. Yeah, I will still come back with the dollars and says if that's what you're asking.
Okay, I got you.
Yes.
How does that work if you need to get the nursing home?
The nursing home one is it's a standard one that we do for anybody that's medical director. So it's $1,000, and then I think on that the nursing home one, it's like something like $50 per visit that they do on the nursing home.
So basically, you're asking us to authorize you to negotiate a contract.
Well, Sherry, yes.
A permanent contract,
Right.
as opposed to because she's
Blanchard.
Right, Sherry Blanchard.
So I move that we authorize Kathy to negotiate a contract on our behalf to employ Dr. Blanchard for the duties that she's described, and that we will be presented with this contract.
I second the motion. Any discussion? All those in favor say aye.
Aye.
All those opposed, the same. Motion is passed.
For the engagement as a nursing home director, and that one I actually need you to be okay with the $1,000 stipend and $50 for the patient
$1,000.
a month, monthly.
Okay, we need a separate motion for that. Okay, so I move that we authorize Kathy to employ Dr. Blanchard as the medical director for the nursing home for the standard contract that we have in place.
Any discussion?
$50, is that for physical residents?
Yeah, taking care of, coming over, taking care of them and doing the physical and checking on them. They have
Once a
a
month.
acute need, yeah, once. Actually, they,
Every 3 months.
every 3 months, or I don't know what it is, Jane, what is it? Is it every 3 months, I think?
Yeah, they have to be seen every 3 months. but
Right,
they'll-
and then any acutes.
I do.
Is it called MICA? MICI? Okay.
No,
Can I ask you a question? So will Dr. Blanchard be the single person responsible for the manor? Or do we have any
she
overlap?
will, we also have Dr. Franklin, he's taking care of part of the patients as well.
She'll take care of
And she'll take care of some, so. But she'll be medical director. And replacing Dr. Sumai. I mean, Sarah Mike.
Any more discussion? Great, are you ready to vote? All those in favor say aye.
Aye.
All those opposed, same. Okay, the motion is passed. Yeah. I think Nick made a motion.
Did you
Yes,
make
I have
a dual motion?
Yeah, and
I'm
Mary,
sorry.
it wasn't a dual, but.
Oh.
Second one. Mary,
I made the second one for the nursing home one.
Okay, I am very
And-
sorry.
Yeah, that's okay.
Mary second.
And Mary seconded that
Okay, that's basically me taking care of. So is there any other old business before Nathan makes his motion? Should I go ahead and make it?
Okay, so I am equally concerned with our level of spending. Building on what John said, we need to be very, very careful with our spending as a hospital. So I reviewed our accounting records for April, May, and June. And for those months, we spent, according to our accounting records, $50,000, $44,000, $51,000 respectively with H&H. So in my opinion, we cannot continue this level of spending indefinitely. And I would like to know when it will definitely come to an end. We have engaged Tony and he's doing a very good job. So what I'm interested in hearing, which I've never heard so far, is I would like to hear just a comprehensive report on what contracts we still have in effect with H&H, when these contracts expire, and what, if any, are the plans for new work, which would drive new spending under the existing contracts. I would like to see the spending come to zero, and I would like to know when that's going to happen. So my motion is to that end, so that we could be informed in our next board meeting about those facts. I have never heard of really a rundown of that at any point, and I think it would be good for us to wrap our arms around that situation. So I'll read my motion if everybody's ready. Sorry, it's not on the agenda. It was something I intended for next meeting, but I thought we might as well do it now.
So, okay, go ahead.
Yeah. So the motion is a vote to authorize that a report be provided to the board on our August 29th meeting detailing what contracts Weston County Health Services has in effect with H&H and when those contracts expire. The report will also include any plans for new work or spending for these contracts.
And I'll second the motion. Then we can discuss.
So is there any discussion?
Yeah. August 29th for our next scheduled meeting.
That's scheduled already? We scheduled that officially?
Yeah.
I don't know.
Yeah, have we scheduled it?
No.
No.
I don't think
Oh,
it's.
we'll have to,
I sent an email
but
saying.
we have to
that
schedule
are
it still,
hoping
so
to
we'll
have
have to do that.
Oh, okay.
But
So maybe I'm jumping the gun.
I just wanted to make sure that I didn't miss
So you
that
could just leave the.
Okay, so let's just say for our next meeting, whenever that is.
next meeting. And that's Nathan just basically to, get like a full report on what are we spending with them still? What does that cost?
Well, yeah, the spending, but also, as I understand it, we had the contract for Kieran and we have had different contracts.
Right.
So I would just like to see a list of all the contracts that we have, for what purpose.
Still outstanding.
And,
Yeah.
and which ones, that haven't expired, when do they expire?
Okay.
And then what plans, if any, do we have for more spending? Because I would like to see that come to be $0 from now and in the future. This is a mess we can't spend, and I'm through Tony's services. So I think our situation is well.
Yes, I don't have a problem with the motion, is the August 29th. I know we don't have anything scheduled at that time.
I'll just say that the next meeting.
Okay,
So,
that's my concern. The next meeting may not be August 29th, maybe a week from now. I don't know what is scheduled, what we're looking at in August, for the August 29th.
That's a good point. Why don't we just make it for our regularly scheduled
That would be
August
better.
meeting?
That would be better.
Yeah.
That's what I was worried about, if it jumps up and
This is our regular schedule.
September meeting,
The September.
right? So that would be September the 9th.
because if we had a week between, may not be time to pull all this.
You're right. This may probably take some of Allison's involvement. I don't know who even has the
Kathy might have
contract.
some
Yeah,
things.
I have information on, well, I'll try to find the H&H contract.
Right. My concern is that, I think heretofore, the invoices are presented to our accounting department and they're just being paid. But as our services with them are tailing off, I think it would be good to make this list and all the contracts that we have, so we can get from them a final accounting of what we owe.
And I did do that, just so you know, we'll just bring it back to you, but I asked them to send me a copy of all of their invoices. So then we check them against the invoices we paid, and not surprising to me, we had about 3 or 4 of the invoices we had not paid yet. So that's part of it. And as far as the contract itself and what it entails, I gotta look for that detail because I have some stuff relative to their work plan that I don't really have. I haven't found the contract.
Okay.
I was,
September would be.
I was under the impression that we were done with H&H. That
Right.
Karen is gone and we're done. So we're done.
I think that's
But
not clear.
I believe there are some plans for her to come back. Even though we voted for her to
And we're
leave the
still getting
administrative.
invoice on things,
Right.
so we need to know.
So I just want to know
what
for the
we
benefit
still
of the
have
accounting
out
department, at what point should we no longer have to pay these invoices as they're presented to us?
But the invoices aren't gonna tell you about what's still out there.
Well, that's
Right.
why we need the contract to
Right.
see where we're at.
And
Is
I
that-
think that we need to pay you said yourself that we need to pay what we owe.
Right, I just want to know, are we using them currently in? Or do we have any plans to use them at all going forward? If not, if we don't have any plans to use them going forward, then it would be appropriate to contact them and say we have no plans for any new work from this date forward. So please give us an account of what you think we owe you as of this date. We'll pay you, and then we will not pay any more invoices at 30%.
What I am understanding from the meeting was that we were stopping our contract with H&H, but at the same time, we talked about Karen coming back for
Pass down training?
training, pass down training.
Yeah,
That's my
we
recollection.
did talk about it, but the reason I asked about the minutes is I thought, so according to the bylaws, no member of the administrative team can be added or removed without board approval.
I would
Okay,
like to call
so
for the question.
we are, we're
I think we're
going
getting
into
off
what
track.
we were gonna talk about in executive session. So we need to finish this discussion.
So let's
and
handle this
move on.
motion and we deal with this next motion.
Chair, I call the question.
All right, is there any other discussion?
I think once he's called the question, we can't discuss anymore anyway. Isn't that correct then?
Well, I think you have to vote. I mean, if you're gonna go technical, you have to vote whether you can call the question or not. But so I get the point. Let's, if there's any other
No,
discussion.
you don't have to vote on my calling the question. It's the chair's discretion whether they accept that question or not, but continue the discussion. So it's your discretion.
Okay. So just quickly, is there any other discussion? Okay. All those in favor of Nathan, might repeat your motion.
Right, yeah, because I did amend it based on Ted's suggestion. Thank you, Ted. That was a good suggestion. So this is a vote to authorize a report to be provided to the board at our regular scheduled meeting in September, detailing what contracts Weston County Health Services has still in effect with H&H and when these contracts expire. The report will include any plans for new work or spending for these contracts.
Okay. Are we all clear?
And that report you can.
At our regularly scheduled September meeting.
Okay, thank you. Is that part of your motion?
Yeah.
Okay.
All those in favor say aye.
Aye.
All those opposed, same. Okay, motion passed. So unless anybody has anything else we can talk about, I think we're ready to move into executive session.
Madam Chair, anything else? I move that we move to executive session 16-4-4058-2 to consider the employment or dismissal of a professional person or employee, 3 on matters concerning litigation or proposed litigation, and 9, receive information classified by law. I think it's supposed to say as confidential by law.
Second that.
All those in favor say aye.
Aye.
All those opposed, same. So we are now moving into executive session.
Go upstairs.
I think we're going to our.
If I'm wrong on any of this, Marty Ertman can sue me. Let her have the burden of doing that right now. If any of what I'm saying is not true, she can sue me and prove that in court. But I had been frustrated by this sort of lack of accountability when the public reacted poorly to a newspaper story about commissioner actions. She would change the story and say that that's not really how it went down. What was your, I mean, I got out of it and then you started covering that beat. What, did that frustration, did you have that same experience leading up to the ultimate frustration of filing the secret ballot lawsuit to put a stop to that sort of thing?
100%. It's hands down the most frustrating situation I've probably ever dealt with through working at the newspaper.
Just so you know, you're muted.
Wait till she unmutes us. Thank you. Okay, ready? I move that we approve credentials for Laura Koenig and Dr. John Haverly.
I second it.
Any discussion? All those in favor say aye.
Aye.
All those opposed, same. credentialing has passed, but I need to sign it.
Yep.
I move that we adjourn.
I second it.
All those in favor of adjourning, say aye.
Aye.
All those opposed, same. Okay, we are adjourned.
Make a motion.
Hey, it's before 9. I'm kind of proud of you guys.
Okay, so.
Okay.
Kind of proud of them.
Oh, the flirt.
Thank you, Alice.
Thank you all. Good night.
Good night.
I think it was.